Part 2 of Chapter 4 will continue with understanding the digestive system. If you remember, we talked about the human anatomy and physiology in the first part of the lecture for this chapter, and we saw that there are many systems, but the one obviously we're focusing on for this course is the digestive system. And when we looked at the digestive system, we saw that the digestive system has many parts to it, and in addition to the basic organs of the digestive system, there are accessory organs that aid in digestion. So as a review, the mouth, esophagus, stomach, small intestine, large intestine, they're all part of the digestive system. And then the accessory organs, such as the tongue and salivary glands in the mouth, as well as the liver, gallbladder, and pancreas, are all part of these organs that assist in digestion. So you want to review all of them and understand their various functions. Moving on to different types of diseases that can occur in the digestive system, there is something called IBD, or inflammatory bowel disease, and it is a group of diseases that cause inflammation in the intestine. And when that happens, it disrupts the digestion and the absorption of nutrients, and damage can occur. You've heard of Crohn's disease, possibly, and ulcerative colitis. These are two IBD forms. There are some things that can happen. Sometimes there's just complaints people have with their intestines. They may not have a disease, but they suffer from constipation, diarrhea. Sometimes they have vomiting or heartburn, or they may have something called an ulcer or irritable bowel syndrome. When we think about constipation, we obviously know that it's difficult to have a bowel movement, but sometimes what we don't realize, it's because of lack of fiber in the diet. Maybe we're not drinking enough water. Sometimes when we're very anxious or depressed, those emotions are tied into our gut, and it can interfere with the digestive process. Sometimes we need to defecate, but we ignore it, and that could lead to constipation. If you don't take care of it, you can develop hemorrhoids or diverticulitis, which is a little bit of a outpocketing that occurs in the intestines and can be very painful if tiny little seeds from tomatoes or nuts can get caught into those little outpockets. So the first line of treatment, increase your fiber, but do it slowly and drink water so that you don't have further complications. Diarrhea is the opposite, where you're having frequent and loose bowel movements. Sometimes it's from an infection. Over-the-counter medication can help. Make sure you're replacing your fluid and electrolytes so you don't get dehydrated. Anyone that is very old or very, very young should be seen and treated immediately. Vomiting can occur, and there's toxic things in the stomach that just need to be expelled. And sometimes it could be from motion sickness. Sometimes pregnancy can cause it. Sometimes people cause it themselves by sticking their fingers down their throat. And sometimes it's a virus or toxic substances that can cause it. So you want to avoid solid food until you stop vomiting. Just sip water to help prevent dehydration. And, call the doctor if it's persistent and not, going away, specifically in the younger and older populations. Some danger signs is if specifically children, if it lasts longer than a few hours and longer than a day in people over the age 6. If it's accompanied by blood in the vomit, dehydration, diarrhea, fever, weakness, headache, stiff neck, severe pain, or any kind of confusion, those are signs to call a physician. Don't take it lightly. I have an acquaintance whose 10-year-old son developed norovirus, which was including severe vomiting, and it was too late by the time she brought him to the hospital, and he ended up passing away. So take these danger signs seriously as a means to react. Heartburn is a different type of issue in the digestive system. It causes a pain or burning sensation in the upper chest. Usually stomach acid is coming back into the esophagus because that sphincter doesn't stay closed. It opens up, and so the contents from the stomach are spilling into the esophagus. And it can be caused by many things: smoking, being overweight, lots of alcohol, being pregnant, and some types of foods. Also, genetics can play a role. So you can do things to reduce the risk. Keep your weight under control. Don't lie down within 2 hours of eating. Don't overeat. Don't smoke. Elevate the head of your bed. Don't wear tight belts or clothing, and recognize foods that cause heartburn. Sometimes you need to keep a food diary and able to do that. A peptic ulcer is a sore that is in the lining of the stomach or the duodenum part of the intestine. You get deep pain and usually occurs around a couple hours after eating. Sometimes it could be caused by H. pylori or Helicobacter pylori, which is an infection and can be detected via blood work. Treatment for H. pylori is antibiotics, and also for peptic ulcers, you want to identify the foods that are aggravating it and avoid them. You can reduce the risks by avoiding NSAIDs such as aspirin or such as ibuprofen and those type of drugs. Any type of alcohol consumption, genetics, smoking, emotional stress, and if you're producing too much acid, these things are things that could raise your risk for peptic ulcers. So you want to reduce your stress. You want to stop smoking. Know your genetics and find out if you are at risk. Keep your alcohol in moderation. And if you have excess acid production, there are different types of medications over the counter that can help with reducing the excess acid. A lot of it can be caused by stress, so you want to keep that under control. Then there's another problem that can occur called irritable bowel syndrome. You get intestinal cramps, you have abnormal bowel function, which fluctuates between sometimes having diarrhea and then sometimes being constipated. And sometimes it is definitely linked to stress, and sometimes people cannot be far from a bathroom because they never know when it's going to come on. So you need to really learn how to manage your stress, avoid foods that could cause the issue as well. Best thing to do is if you're having any of these type of digestive issues, hire a nutritionist, work with your doctor, and get the doctor to diagnose and test it and treat with medicines if needed, and then have a nutritionist or registered dietitian help you with your diet to help control the symptoms and the disease. So that's it on chapter 4. It has a lot. As I said, these recordings are just a brief overview. Please continue reading your chapter and the other presentation slides for more detail.